Are you facing challenges in your health? Then Dr. Suleiman Clinic and Labs is here to provide you with the lasting solutions to your health problems. Dr. Suleiman Clinic and Labs is specialized and offers consulting in psychiatry, internal medicine, cardiology, urology, dermatology, gynecology, infectious diseases, and infertility. At Dr. Suleiman Clinic and Labs, we offer 3D/4D scan at just 5,000 francs, emergency ambulance, free ultrasound scan, and free medical consultations. Our staff is composed of well-trained doctors with good laboratory and best equipment. We are located in 2 cities, Boya at Mile 18 Bolifamba, and in Douala, we are located at Entre Pilot. You can reach us through the telephone number 694-940-172. Your health is at the right place with Dr. Suleiman.
There's another hormone called prolactin. I'm going to tell you a story happened to me like 2 months ago or so, okay? A guy came in, a young man, but this is not a sexual weakness. This is just, I remember the case because sitting in front of me, his eyes cannot see with one of the eyes, and the other one half and half, so and so, headache, and I looked at him and since when? Oh, long time ago. And what is going on? I don't know. Nobody knows. The man came, actually is very, not financially very, he's a farmer, Looking at the man, and I examined the man, and I realized it was prolactinoma. Actually, that's we're talking about. We're not talking about prolactin. That's a prolactinoma that is pushing against the chiasm, which is the optic nerve, pushes the eye out, the optic nerve out, disturbing his vision. That can be only confirmed by something called an MRI or so, and we take prolactin level. Anyhow, we did the basic test, and we already know that is a prolactinoma. Just 2 small tablets. 2 small tablets will take care of them. Something to subside and shrink the pituitary or the prolactinoma inside the pituitary and relieve the chiasm from the pressure, and that took care of them. 2 small tablets and it's good. But you have to have now a neurosurgeon who shrunk the tumor. Now you have to go find a neurosurgeon to do the operation for you and take it out. Okay? But that is, we helped them with 2 tablets. And he's no more, the pressure on the eye has been relieved. It's okay. So now let's go back to prolactin. What is prolactin? And this is also for the woman out there. Very important. When your prolactin, that comes from the pituitary gland inside the brain, when your prolactin is high, that is inhibition of fertility for a female. And that's also inhibition for a male. How do I know? In a female, it's easy to know if prolactin is high or not. It's very easy. How? Squeeze the breast will come out, will show milky discharge. Galacturia, milky discharge will come out. Now we know prolactin is high. Next step is to measure and give medication, shut down, and everything is solved. No problem. So if you suffer in infertility and you're female out there, squeeze the breast, see if the nipples produce some milky discharge, your prolactin is high. But can I do the same thing for men? Squeeze the breast and milky discharge will come out? Less likely. Why? Because women have enough estrogen, okay? And estrogen and prolactin together is responsible for showing the galacturia. When you squeeze the breast, the milk will come out. But in a man, he doesn't have estrogen. Unless it's a different case with gynecomastia and we have estrogen in the body, then the man will also show discharge from the breast when you squeeze. So there are also other hormones that can affect impotence, like prolactin, okay, which is inhibitory to the reproductive system, male or female, by the same mechanism. By the same mechanism. Now, let's talk about something else. Any drug that you take in, let's say you are psychotic, okay, you are psychotic, you are not normal, and you give an antipsychotic medication, some of them cause sexual weakness. Have you seen before somebody on schizophrenia medication and sexually active? Less likely, unless the doctor is good and he reduces the dose and gives something that does not interfere with sexual dysfunction. Right? Yes. So I don't know if there is something else to cover, but let's take 1 minute break and then we'll talk about what can we do. What can we do regarding sexual weakness? Let's take 1 minute break. Welcome back. So now we have discussed, I think everybody should understand. If you have questions, send me an SMS, send me a WhatsApp. My number there is there, 694-940172. I will be happy to read the message, but I don't think I'm going to answer anything today, except maybe next session or so. Okay? Yeah, so let's talk about the treatment. And we're going to summarize the treatment in 1 or 2 lines. Tablets. We give tablets that has to do with increasing the diameter for, tablets increasing the diameter for the arterial blood vessel that has to deliver blood into the penis. So those are tablets. And there are now many variety of tablets. There are tablets that can last you for 24 hours. There are tablets that can last you for a few hours. And now there is another thing also, which is injectable inside the penis. You put injectable that can last for an hour or so. And there is also now the vacuum. Remember what I have told you about the mechanism of erection? The mechanism of erection is to increase the inflow, decrease the outflow, right? We have a device called vacuum. I don't have a picture of it. Maybe I can supply it to you later. A vacuum, this is like a device. You put the penis inside and you put like a ring, like a rubber ring at the base of the penis to constrict the outflow, and only with the vacuum you increase in the inflow and you'll have an erection. It's a mechanical device, and then you will have an erection. And now, lately, they have an implant that you can put an implant, and this is actually have reached more than 95% success. Those are for men who they have heart failure, they have heart problem, they have diabetes, they have this, and reaching an erection is not possible. So now they do the implant and they will have. And they control the erection by something in their waist, and then it's fine. It's working fine. It's working absolutely fine. But this is something that requires small surgery that to put the implant inside. A urologist can be very handy in this case to put this implant inside, and then the man even at later age can have good sex. We have another video, okay, we have another video to play, but we only have like maybe 5 minutes left. I don't know the length of the video. I leave it up to the production for them to decide now. If you wanna play the video or close the session without the next video, it's up to you. So this is the Becker cyst. This is on the right popliteal fossa. But to be 100% sure, we'll put the color Doppler, make sure there's not a blood supply. Okay. So obviously there's not a blood supply, so the next step is we're going to do needle-guided ultrasound aspiration of the cyst. Okay? That's what we're going to do. So we'll kill the color, and then I'm going to need assistant, somebody to hold the ultrasound, or I get the needle to mark where I'm going to go. Give me the needle. So, I go from here. But we're gonna edit this because this is too much. So stop it only when I tell you to start. Yeah, put it in the needle here. Okay, hold this for me. Hold this for me. And then we're gonna do this. Make it tilted like this till it's. You see the needle going in? You see the needle going in? You see the cyst is decreasing? Almost to none right now. Okay, now put the video here. Put the video here. And this? Very small. You got it all. Thank you. Okay, so we can put it in the shoulder. So this what we have taken out. This is ultrasound guided, but he didn't film with the ultrasound. We're going to do the next knee, ultrasound guided, and you see this is what we took out of the cyst. This is Baker's cyst, and this is what came out of the cyst. Okay, so this is Baker's cyst. And we suck in this. The fluids are a bit thick, so it's harder to put in the syringe. But we are sucking the fluid out of Baker's cyst. Yes. It's coming? Huh? Yes. But we have to be very careful. We have the popliteal artery right there. It's coming?
Yes. As you can see, yes.
It's coming?
Almost finished.
Yes, it's almost finished, yes. You see the needle? You see it's collapsing the place now. Okay, it's very much finished. Okay, we're successful. Here it is. That's the Becker cyst.
You see how many?
Okay. Okay, the needle going in. You see the needle? All right, that's enough. Thank you very much. And this is a topic that maybe we're going to touch upon next session. This is somebody with a knee pain, especially on the back of the knee. There's something called Baker cyst, and you see, when you have pain on the back of the knee, the legs are heavy. There is very important diagnosis that a doctor can have to do, which is DVT, deep venous thrombosis, that clot in that thigh or the leg can travel up to the lungs, and that's deadly. So we have to eliminate this as a possibility by doing an ultrasound. Make sure you compress the vein. The doctors will know how to do it. Compress the veins, make sure it's not a clot. And the second possibility is that fluids that we collected because of maybe arthritis, maybe other things. But this is an easy way to take it out. We must take it out, and then we give an injection to the knee to subside the symptoms and take care of the arthritis. But here, the biggest differential diagnosis, meaning you have to be very careful and you have to investigate anybody with a pain in the legs for DVT. You have to be sure there is no clots in the legs, because one of those clots can make it up all the way to the lungs, and the patient will be at risk for pulmonary embolism, which clot in the lung. So any patient with a leg pain must be evaluated for a DVT. It's a must, especially if the pain in the back of the leg. Okay, thank you very much. We're going to touch upon this topic again maybe next session. God bless you all and have a wonderful weekend. Thank you very much for listening.